This segment is sponsored by Women's Health Physical Therapy and Men's Pelvic Health.
Our next guests specialize in abdominal and pelvic health, and they're here to share more about their services and why they're so important to men and women. Joining us by Skype are Dr. Casey Smith and Dr. Emily Driscoll. Ladies, it's wonderful to see you this morning, and this is a pretty important conversation to get started with. Thanks for joining us.
Thanks for having us.
Let's talk a little bit more specifically about women's health, physical therapy, and men's pelvic health. I think many folks are going to be surprised that this is such a niche, targeted area of focus.
Yes. Oftentimes, women and men go to their OBGYN or urologist or primary care provider with complaints that maybe that doctor isn't equipped to solve based on their training. And this is where we step in as women's health physical therapists to bridge that gap in healthcare. We're specialty trained to treat conditions in the musculoskeletal system, primarily in the abdomen and pelvis. And many of these can arise during pregnancy, the postpartum period, menopause, or post-prostate surgery. We have specialized training to treat these, and examples might be urinary or fecal leakage, abdominal separation, pain with intercourse, or pelvic pressure. And we're here to promote awareness that these are real medical problems that impact people's muscular support system, and they can be improved with physical therapy.
And Dr. Driscoll, these certainly impact quality of life for so many people, and probably by the time they're making their way to your office, they have taken quite a bit of time to even address this issue with primary care. It can be somewhat embarrassing to say I'm experiencing these issues, but the good news is there's hope on the horizon.
Absolutely, absolutely. So with pelvic floor therapy, we work with each patient to create a customized care plan based on their conditions, their symptoms, and their lifestyle to help them get back to their goals. We'll start with a full body assessment to get the big picture of what may be going on. For many patients, this may include an internal vaginal or rectal exam, similar to what would happen at the gynecologist, minus the uncomfortable speculum. However, with this exam, we're looking at how the pelvic floor muscles are functioning. And this is something that's typically not addressed at your annual. And the pelvic floor muscles are, of course, the muscles that surround the urethra, the vagina, and the anus. What treatment includes is going to depend on each person's goals. We may be working on helping the new mom return to running through a strengthening program, reducing muscle tension in the young woman with vaginal spasms, or improving tissue quality and muscle strength in the postmenopausal woman, who's having leakage or pain during sex. With many of our patients, we teach them how to breathe properly, how to coordinate the breathing with their pelvic floor and abdominal muscles to induce relaxation and improve function.
The important takeaway here, too, doctors, is some of the conditions that you shared. You don't have to live this way. There are things that can be done. You have a program called Postpartum Strong. Let's talk through that and the details.
Okay, yeah, so maternal health is something that has been historically overlooked in the United States. In recent years, and actually the past year, the American College of Obstetricians and Gynecologists, as well as Dr. Northam, our governor, have endorsed medical practitioner care for postpartum women. Many are just now realizing that the female body doesn't just bounce back after 9 months of pregnancy and childbirth. In other countries such as France, routine postpartum physiotherapy care has been standard practice for decades. The Postpartum Strong program is a research-supported rehabilitative program. We're taking a look at the muscles of the pelvic floor, the abdominal muscles, the bony pelvis itself, and the spine. And again, many women find that they're not as strong as they used to be after they had a baby, or they may be leaking. They may be having pain during sex, which we definitely want to address. So our program takes a look at all of these different issues. We find the dysfunctions and we help people manage them through education, exercise, and lifestyle changes.
Well, doctors, it's great talking with you today, and it's very encouraging to know that there are resources in place to help make a difference in so many ways. Thanks for being with us. We really appreciate it.
Thanks very much.
Thank
Bye.
you. You can learn more by visiting online obgyn-physicaltherapy.com or call the office 804-282-3500 and visit on Instagram Women's Health PT or on Facebook by searching Women's Health Physical Therapy. Stay with us. Virginia This Morning returns after a quick break.